will move to item 6A.
Item 6A is Community Organization Service Organization Reports. A, Continuum of Care Presentation on Homelessness in the Region. Christopher Garvin, Deputy Executive Director, Department of Human Services, and Beth Rolstad, Executive Director, Continuum of Care.
Good morning, President Glenn and Commissioners. I'm Chris Garvin, Department of Human Services, and I'm here to introduce our presenters today for the Continuum of Care update that Commissioner Vanderwerth asked for a couple months ago. Apologize for the delay. It took some time to analyze the data and to pull together scheduling, so here we are today. I'd like to introduce, also let you know that myself and Deanne McCann are your representatives on the Continuum of Care Board for the Pikes Peak region. And then I would like to introduce Beth Rolstad, who's the Executive Director of Homeward Pikes Peak, and she's also the current chair of the Board of the Continuum of Care, and Jennifer Mariano, who is with the Community Health Partnership, which is our collaborative applicant for the COC dollars that come from HUD. So here we are. Thank you.
Good morning. I'm Beth Rolstad, Executive Director of Homeward Pikes Peak, and we've split up our presentation today, so I'm going to let Jennifer introduce herself and go first. Thank you.
Good morning.
Good morning.
Good morning. Thank you for allowing us some time on your agenda this morning. I'm Jennifer Mariano. As Chris mentioned, I am the Pikes Peak Continuum of Care Program Manager. For those of you that may not be familiar, the Pikes Peak Continuum of Care exists to end homelessness in the Pikes Peak region. We are guided by regulations from HUD, Housing and Urban Development, and that is to give voice to homelessness in the Pikes Peak region, coordinate planning amongst government, nonprofit, and other local entities, convene a robust forum of these entities to address these homeless issues together, and to collect data on homelessness to ensure that we are addressing the correct problem. Before I continue, Amy Cox, our CEO, wanted to make sure that I thanked you. The El Paso County has been a great supporter of the Pikes Peak Continuum of Care and provided support towards our need for matching HUD grants to be able to address homelessness in the Pikes Peak region. So why is our partnership with you so important? Well, what we are looking to do is to create a healthy, vibrant community with you, doing that through ensuring that families and individuals have access to housing and services that allow them to optimize their self-sufficiency. We do this collaboratively, working with other homeless providers, government entities, faith-based, the entire community, to ensure that families and individuals have the resources that they need to become self-sufficient. We work to create and sustain a durable system of care that prevents to end homelessness and help individuals, again, attain long-term stability. And finally, again, with that data piece, working to identify where there are gaps and needs for services within our community. All right. So we talked about HUD governing the Pikes Peak Continuum of Care. And these are some of the activities that you'll see on the slide in front of you that we do. So we have a governing board. There is a list on the handout that I provided you. We have a number of local homeless providers that are from the area, as well as government and other nonprofit leaders that are on our board that help to work on these different issues. We also strive to have a homeless or formerly homeless individual to help us guide and work on different issues in the community. One of the roles the Continuum of Care is that we set the administrative lead for the Continuum of Care, and that has been designated as Community Health Partnership. We also designate the collaborative applicant, which is also Community Health Partnership. And what does that mean exactly? Essentially, that collaborative applicant is applying for HUD funds on behalf of a number of providers in the region. That amount is $2.5 million that comes into this community to help support the different providers that are providing housing and supportive assistance to families and individuals in this area. And then last but not least, we govern or oversee the homeless management HMIS information system, and that is also overseen by Community Health Partnership. And that is where our homeless providers put in data about the clients that they're serving so that it's a collaborative process. They would do coordinated entry so that they can ensure that individuals that are being seen in different by different providers, that there is a kind of a collective effort across all the different providers and how their services are being provided to them. So the numbers piece that we're all curious about. Community Health Partnership just recently officially released the point-in-time study from the study that was done in January of 2018, and there were some very interesting data points that we review a little bit in here, but there were some other points that we wanted to point out in today's presentation. The population growth rate in Colorado is pretty significant, as most of you know, but what we have seen is that the homeless population has continued to grow at a significant rate, and one of our jobs is to figure out why and what we can do about that. In doing some research to prepare for this presentation, one of the things that I looked at were states that were seeing increases in overall homelessness and states where we're seeing decreases in overall homelessness, and trying to figure out if there was any connection as to why certain states were doing better at it than others. And basically in that information, I discovered that cities that are decreasing in homelessness, all of them have a couple things in common. And one is that they are utilizing a housing first model approach, lessening the barriers for people to access housing. They are highly collaborative in their efforts, and they utilize a regional approach. Cities that were experiencing higher or increased or no changes in the number of homeless individuals lack affordable housing, have few low barrier services, so it's rather difficult for individuals to access assistance, and there was a lack of coordination between cities and counties within those areas. I did provide resources on the PowerPoint because I think there were some pretty specific data points that really pointed to what was making a city or a state successful in their process. So more numbers, and probably rather difficult to see because there's so many up there, but essentially these are charts that came directly out of our point-in-time study that was done in January of 2018. Unfortunately, we did see a rise in the number of homeless individuals in this community. I can say successfully, we've added more beds for those individuals to access. One of the things that we discovered in that study was that not necessarily all of the emergency shelter beds that were available were being utilized. So one of the things that we seek to do is to figure out why, and based on some conversations during the point in time, making sure that individuals have access to physical beds versus mats has a lot to do with whether they're accessing that or not. There's also some talk about doing additional surveys with our clients to see if there are other barriers to access in emergency shelters, so more to come on that. The other piece that more research to follow is how income is impacting the number of homeless in the area, if it's staying in line with increased housing costs. I think another thing to really that we discovered in the point-in-time study was such a huge disproportionate effect on not only African Americans, but people of color in the Pikes Peak region. We see that there are about 6.9% of our population in El Paso County that are African American, but what we found in the homeless population is that 15% of our total homeless population are African American, and 19% are youth. So that's a pretty huge disparity, and so there are some balls in motion to begin to sit down and talk to different organizations within the community so we can figure out how to address this together as a community. Not only affects African Americans, but the Hispanic population and mixed populations as well. We're seeing a higher number of homeless in those two particular areas of people of color than we see in our general population. So that's definitely something that the Continuum wants to look at and address in the near future. And I think kind of my last point before I pass it over to Beth is that homelessness isn't a city or a county problem. It's a regional issue that affects every branch of government, from the Forest Service to the police department, the fire department. Funds are being spent out of a number of budgets in order to provide services. The city of Colorado Springs estimated that it costs about $57,000 a year to provide services to someone who's living on the street. And research that we have done indicates that it conversely costs only about $13,000 a year to provide services to someone that's in housing and being provided supportive services. So with that, I will turn it over to Beth.
Thank you, Jennifer. In our community report that we released in August, we came out with a number of recommendations for the community to consider and also to partner with elected officials and service providers. So that's what I'm going to walk through now. One of our recommendations is to continue to increase the number of low barrier shelter beds with high quality services. We are well on our way to achieving that goal. Hopefully by the end of December, we will have 370 new low barrier shelter beds available through a combination of expansion both at the Springs Rescue Mission and at the Salvation Army's R.J. Montgomery Center. We will not be seeking an emergency warming shelter this year because of that expansion that is occurring at those two main shelter organizations. What we also are seeking to do is to work with the community and the developers to increase the quality and the amount of affordable housing that runs the whole spectrum of serving the very low income up to workforce housing. You may remember the city and county participated in a housing needs assessment in 2014. At the time, they identified our community needed about 24,000 housing units to serve all the way up to workforce housing, which was considered 120% of area median income. So this housing, the lack of affordable housing, has a trickle-down effect, if you will, that as we have less supply for those who are working and on the edge, it hurts the lowest income people and those who are trying to rebound out of homelessness. The third area that we are working on aggressively is landlord engagement. We know that many of our landlords who do offer apartments in the community have concerns and questions about what is it like to work with a formerly homeless individual. Are they at higher risk of breaking a lease or destroying property or being a bad neighbor? So we are partnering with landlords to talk about the benefits of working with service providers that are placing individuals in these apartments and helping them understand the system that funds those apartments so that they can utilize and accept vouchers when a client comes forward with a voucher. Additional recommendations regard to systems that we can put in place to be more effective. One of those recommendations is increasing street outreach or general outreach in locations where we know individuals congregate. There are a number of service providers that have staff going out into the community on a daily basis to reach those who are not coming in to use the food pantries or the meals that are available or the resource and referral center at Springs Rescue Mission. Street outreach is known to be one of the most effective tools to reach clients where they are, to build trust and draw them in for services. So we're working on that. Homeward Pikes Peak has staff doing that. Urban Peak, Catholic Charities, and Springs Rescue Mission, though we know it's an area that we need to expand. Finally, well, not finally, but additionally, encourage provider coordination and accountability. This is something that database we call HMIS is highly effective at doing. We seek to have a very high quality data input rate and quality rate so that we can truly see who are being served and what services are most effective in changing someone's outcome. We are moving towards a new software service provider. This is kind of in the weeds, but we are very excited about this because it has increased functionality for us as providers to share information between each other and to pass on a referral inside the system and then track if a client has engaged in that referral rather than a staff person saying, just go down to Catholic Charities, please, and they'll help you. And we can do it inside the system now and track it more effectively. That process is underway. We'll be starting that new software piece this fall, so we should have it well underway by January. And then finally, encouraging providers to use that. So right now, if you receive HUD funding, you're required to participate in HMIS. We would like to invite other service providers that touch in poverty prevention work to also use HMIS so that we can have a bigger scope of information and data sharing. Our next area of recommendations are programs and people. So again, outreach comes back here because we need to understand the barriers that people are facing who are choosing not to access services. We know through the research that substance abuse and mental illness and a distrust of the system is one of those issues. But if we can seek to understand their points of view, find the right referral and build trust, then we think we can more effectively and efficiently move someone into resources. We know that there could be a holding pattern. Not everyone who comes in for resources is going to get housed, because we spoke earlier about the lack of affordable housing. We simply do not have enough housing vouchers to house every single person that is experiencing homelessness. So that's why we really must focus on the whole issue and not just street outreach. We have to work with the community on development of housing as well. As Jennifer shared, we are concerned about the overrepresentation of individuals, minority and people of color who are experiencing homelessness. This ties back to the data that people of color experience poverty at a higher rate than Caucasian citizens. So we want to work with providers in the county on poverty prevention programs, helping people access workforce development and job training so that they can, elevate their personal income. But we need to develop strategies that speak to communities of color. There's not a one-size-fits-all solution for this issue. And finally, the Continuum of Care is working on increasing legal aid. The City of Colorado Springs and the Municipal Court is working with service providers in the Continuum of Care of bringing forward what we would call a homelessness services court. This is one of those problem-solving courts like vet court or recovery court that helps individuals minimize the additional charges, criminal offenses that they face if they engage in supportive services, case management, and resources. We know through experience of other cities who've implemented a homeless services court that it's a little bit like a carrot and stick, that someone's encouraged to participate in services, and when they do, they have a mindset shift that this is working on their behalf, and it is a win-win. They get help, they may get a job, they may get housed because they've eliminated this barrier to housing and employment through working with case management. So this is something that we're working on. We have the American Bar Association giving some consultation to our community. We hope that we can launch this within the next year. So how can we partner better together? What can the county do with the Continuum of Care? And back to Jennifer's point, we really believe this is a regional approach. The city and county and the Continuum of Care must work together. One of the things that we know the county provides funding through the CDBG and the El Paso County Housing Authority. The grant making is wonderful. Some of it is directly tied to homeless services and some of it's tied to poverty prevention. We think those need to continue, and we would recommend that if there's additional funds that you can use to match federal dollars, please find it in the budget to do so, because any poverty prevention program end result reduces homelessness. We've also noted that the El Paso County Housing Authority has provided some support to both Greenway Flats and the Freedom Springs permanent supportive housing projects. Both of these would, when they come to completion, they'll provide 115 units of permanent supportive housing in our community, which is that housing first model of giving the chronically homeless person with multiple barriers a roof over their head first and services later. It's a highly effective model. We would also encourage the county to continue its efforts to fund emergency shelter networks of support. We know that there needs to be not only high communication between our main shelters, but also collaboration and funding that supports them individually and working together. We would like to ensure that resources are available to smaller and rural communities to access these main community assets. We don't expect smaller communities like Calhan to open up an emergency shelter, but we know homelessness happens in all corners of our county. So how can we help the outlying smaller towns and cities get individuals who need the help into the downtown area where the shelters are, or fund program staff to go out to our outlying areas to provide that level of support for the larger community. We have also worked with Deanne McCann from the El Paso County Housing Authority to work together with the Continuum of Care so that we are in constant consultation mode and an open communication feedback, so that what we're doing is passed up to you all, and what your thoughts and concerns are brought forward to the Continuum of Care. We think that is a major goal for us. We know that we have challenges. The housing stock is really one of our biggest challenges. Funding for supportive services will always be there. There seems to be more need than there are resources. We are working at being effective organizations and utilizing our dollars to the most efficient way we can, but we know there's always process improvements, so we want to work with you all to do that. Finally, one of the things that we seek is a clear system of leadership and communication, so that the flow of information of concerns can come to the Continuum of Care so that we can partner directly with you. The governing board is the sanction group that is supposed to work on strategies and policy with elected officials. So we invite you to work with us more closely. We're so pleased that we have Chris Garvin and Deanne McCann on our governing board, but we just want to increase that communication with the commissioners. So basically that's our presentation, and we welcome any questions you may have.
Questions? Comments? Commissioner Vanderoy.
Thank you, Mr. President. First of all, thanks very much for coming here. But perhaps you had been here in the past, but and I may be mistaken, but I think this is the first time the Continuum of Care has been in front of this particular board that I'm aware of. So I'm glad you're here, because I agree with the comment about increasing that communication. I think that's really important. I have a couple of questions, some comments. In that Emergency Services Authority meeting yesterday that I mentioned a few minutes earlier, about Crossroads and the detox center, which they are moving from, where it is presently, and that move is supposed to be complete by the end of the year. But one of the things they're going to be doing is offering a medical component to those services. So if you're already working with them, great, but I think there's actually going to be a substantive increased community value coming as a result of Crossroads doing that work. One of the other things, and I've mentioned this several times, and this is, not all of our homeless are from the local area. They do come from other places, but for the ones that do become dependent on something, alcohol or drugs or whatever, that are from the local area, a great method or choice is prevention, to get them to never be there to begin with. So one of the things that Crossroads does is they have programs where they work in high schools and provide preventative programs to those high schools to try and keep our kids off drugs and alcohol, or away from being addicted to them. I think that's a great component of what Continuum of Care should be working on. Perhaps you are working on it now, which is great, and I would encourage you to do more. I also know, one of the other challenges is vets, and I don't know if you have data on vets. The numbers I've heard is about 10%, something like that. Mm-hmm. Is that about right?
That's about right.
All right, and I'm hopeful that you're working, but you probably are, working extensively with Mount Carmel and some of the other vet service providers to kind of work in that arena as well.
Could I speak to that real quickly?
Yeah, just very briefly, sure.
We have a coordinating council that Rocky Mountain Human Services leads, that the Continuum of Care liaises with monthly, so we are working on the veterans issue as well, and Mount Carmel is a member of that committee as well. Excellent.
I do know also, I think kind of the general term is this term called supportive services. The term I have tended to use is counseling. Supportive is probably a bit broader, but I do know that the real value helping people in need like this is counseling, to get them into a place where they can have a professional talking to them about how to get through their blockage. And I just encourage you to do as much of that as you possibly can. Figure out ways in the low barrier housing environment to get these folks into a counseling environment as well, because that I think is just really, really valuable for us kind of working strategically through this. And I see that Andrew is here, and I know that some of us were at the COS I Love You dinner, which is actually a faith-based environment that's working in this arena as well. Perhaps you're working a lot with them, but if you're not, I would encourage you to work more with them. I was pretty impressed with what they've been able to do on behalf of Colorado Springs and working on this issue, to include raising money. So they, I think, would be a great team member going forward. And then, of course, the last one is families. I'm hopeful. I didn't hear it, but I'm hopeful that you all are working on for these folks in need who have a family somewhere in the area. I am hopeful that we are doing everything we can to get them reconnected with their families, because the best way to solve these problems is for the families to be a key part, if not the key part, about helping these people overcome these issues. So, but thanks for coming. I look forward to the future dialogue, and those are just some of the comments in ahead. And again, appreciate your being here. Thanks.
Commissioner Gonzalez.
Thank you, Mr. President. So when I see information like this, and thank you very much for all this, and I know everyone's doing what they can to help this out, is underlying information. So what is the underlying reason these numbers are increasing so much? So I don't think it's just the fact that housing costs have gone up. Drug use increasing, sometimes economic factors, but the last couple of years, the economy has been a little bit stronger. So that doesn't look like it. When they say we need to get more affordable housing, I understand that, and I agree with that. But that's not the underlying reason. What are the underlying reasons this is increasing, so that we can then compare? If it's housing costs, then I'm going to ask, well, what's the homelessness? Is homelessness increasing in Pueblo County? Because their housing is much more affordable. I see Texas and a couple other lower cost states also having increases, where in general the whole country is coming down. When I hear Texas as one of these places that's increasing, well, affordable housing isn't necessarily that. I mean, that's a lower cost area. Unless you're talking about general cities, then I think what's really important is comparing cities to cities, if that's a separate issue. But I kind of like to know what are the underlying issues. Is it drug use, marijuana, a lot of other things that can then help us as a community address those issues?
Well, I think that you can't talk about housing without talking about wages. And we know that the cost of housing has gone up 24% in the last 5 years, whereas wages have only gone up 10%. So we're not keeping pace to have the affordability of housing at all levels. And yes, there's been some economic recovery also in the last 5 years, but that doesn't reach down to the lowest level wage earner in our community. So I think that is an underlying issue. You mentioned the substance abuse, and as did Commissioner Vanderwerf. There's a nationwide epidemic of an increase of opiate abuse in opiate addiction. That is happening in our community as well. So substance abuse, yes, is an underlying issue of the increasing numbers of individuals affecting homelessness. We still would like to do more gap analysis of what is happening. So in the next year, we're going to add a second survey. Usually the point in time survey happens in January. We're going to add a second deeper dive into the why, so that we understand some of these underlying issues. But I hope that you have the report, and if you don't, we will make sure that you get an email copy today.
Please do.
There is a lot in here that speak to some of the underlying issues, but in trying to give you 10 minutes or less, we couldn't dive into all of that.
Commissioner Littleton.
Thanks. So certainly appreciate what you guys are doing. And when you guys first stood up, I think it was probably before some of the commissioners here were on the board, that we had a presentation, and I think Chris Garvin was with them, and Deanna McCann and others. So this is not the first time I've heard, but I think you've come a long ways in delving deep down into some potential ways to assist those that are struggling with homelessness. You know, I like the fact that Commissioner Vanderwerth recommended family reunification. You know, family reunification is always the best, you know, whether we look at it in our foster care system and or homelessness. Because sometimes people don't even know that a relative of theirs is homeless or struggling with those particular issues. Secondly, you know, as we look at some of the causes, you know, some of the people, and when we look at, you know, especially opioid addiction or others, people have lost hope, and offering hope, I think, is really a thing that we need to look at. How do we do that? How do we offer hope? And as we look at moving people into possible locations that have a graduated scale of rent and or, you know, to move them up, to give them that hand up as opposed to just a hand out. I know a number of people would really appreciate that, and I hope that there's a scale that we do that. Who's going to the Pikes Peak Workforce Center? Because we already provide for that service to increase your skills, get other talent, get your name out there, and figure out how to do a resume, you know, how to present yourself. And I think a lot of people do take advantage of that. But those are some of the things that hopefully are requirements as we move people through and assist them to give them that hand up. I know that Travis and I from the Springs Rescue Mission were on the Chamber leadership trip last week, and we were talking about one of the things where, you know, as opposed to giving to panhandlers, the option of maybe citizens being able to purchase gift cards, if you will, to different restaurants, or to go through the Springs Rescue Mission, you know, as a donation, but be able to go down and go pick up those gift cards that they could give to someone that was a meal at Taco Bell or a meal at Chick-fil-A or something like that, as opposed to just handing out money. I mean, if it is true hunger, and that they would have an account, but they would only be charged for that if that person actually went to go redeem it. You know, because in that way, it's a compassionate way for people to think, to know that they're assisting, and, you know, and with that, give them some sort of, you know, an address on the back of it, like here's Springs Rescue Mission, here are some other locations you can go, so that you can help be compassionate, but give them a way forward too with a little bit of direction. So some of the things that we talked about. Thanks, you guys, for what you're doing.
Thank you.
Commissioner Vanderwerth.
Thank you, Mr. President. You know, some of the other things that we've done in the county, and you may know this, but just maybe get it on record and public record here, is for the Community Services Block Grant Program, the board elected to convert the preponderance of those dollars from emergency services into services for self-sufficiency, because really, from a strategic point of view, the best thing to do is invest in helping people get to a place where they become self-sufficient themselves. This is, I think, a great thing that we can work on. And I know sometimes some communities, they don't do as much of that as they should do, right? I can also say, and I think that I'm very proud of this, that the Department of Human Services for El Paso County and the Pikes Peak Workforce Center have been tightening up their relationships and providing a path through which people that have some of these issues, a blockage of some type, to not only just kind of work on the blockage, that part of it, whether that's addiction or mental illness or whatever, but then get them into the workforce center so that they can get placed into a job, which allows them to get to self-sufficiency. So I think that's a really, really important kind of second stage that I believe we've done quite a lot as far as addressing the process on how to do that well. And we have a great workforce center. They did 17,000 placements last year. So they've got a lot of capacity and ability to try to deliver jobs for people so that they can get to self-sufficiency. So I just wanted to bring that up because that's something the county's also been doing here for some time. Thank you.
Any other comments, questions? Great job. Thank you very much.
Thank you. Have a good day.
And we definitely would like that full report sent to us.